Hello guys, I am Dr.Hrithik, Human System General Physician. Today's topic is continuation of the interest interpretation of the test in general medicine first chapter. Okay, continuation. Okay, today's topic is specificity and sensitivity, which means in the sending of the diagnosis test to the patient after receiving the complaint. It is considered as specificity, specificity and sensitivity. Specificity means which is giving a true positive test, and sensitivity which test giving false positive test. Okay, remember that. True positive test means in 90% of the patients giving true test means exact test result in 90% only. And sensitivity means it's giving after examination of the under pathological disease of the body, like specific organ present in the body, this is called specificity test. Okay, in sensitivity test, example for examination of the functions of the body, like ECG and the USG of the abdomen. ECG, some conditions very important for giving only 10% giving false result. This is remember this mistake happening in the diagnosis test. Okay, some patients coming to me, severe chest pain in the thorax region. I am sending to the ECG. It's showing result normal. Okay, this mistake happening in the sensitivity test. Okay, that's why it's very important for physician be alert in the examination of the patient. Please ask past history of the patient. Ask past history of the patient. And very important for asking family history and other incident of the patient. Don't go directly to the investigation. It is not good for patient. Please ask complete symptom of the patient and then go other small investigation and then go to the higher investigation. Okay, some mistake happening in the diagnosis test like specificity and sensitivity test. Okay, and another example is the patient's severe chest pain in the echo bone. They are coming to me, the severe chest pain in the echo bone. I am sending X-ray, and after the investigation, X-ray showing normal result. That's why some condition of mistake happening in the diagnosis test. Please ask lifestyle of the patient, complete lifestyle and history of the patient to know the what happening to you. Okay, knowledge is very important than technology. Okay, please physician be careful. Knowledge is very important for patients. Asking complete history, lifestyle of the patient, and then go to the investigation. Investigation showing 90% are good, but only 10% some mistake happening in the test. Okay, these are very important for clinical practice. Okay, the topic is over. We meet on the next day. Bye. Love you all.